What's going on, everybody? Your boy Porkchop here, 92Q. You already know what it is. It's about COVID. It's about health, and we got all the questions. I know you got a million questions. Everybody in the media have been talking about COVID, the new strand. So we had to go to the person that knows. She knows everything about COVID. Dr. Dzirasa, how you doing?
I'm doing pretty good, Porkchop. How are you?
I'm all right. You at work? I see you still there working.
I am. Yes, it's the pandemic, so I always got work.
How long you be at work for you being who you are? And matter of fact, before we even start that part, tell us your title. What do you do?
Yes. Thank you. I am the Commissioner of Health for Baltimore City. So I lead the city's health department.
Oh, okay. You the main one then, big dog at the top. How hard has it been for you going through COVID? And people probably think, well, Dr. Dzirasa don't worry about nothing. She's the doctor. She's the head. She don't go through anything. How has COVID affected you?
I would guess that the challenges for me have been similar to those for others, right? I worry about my family. I worry about them being safe and healthy. I have a 4-year-old and a 19-year-old.
Oh,
I'm lucky that my 19-year-old is vaccinated, but he started college this year, and so
yay!
imagine starting college during a pandemic and what that looks like. And he wanted to live on campus, so he did. And then my 4-year-old, knowing that he's not eligible to be vaccinated, just the concerns that go with him having to be in daycare because both my husband and I work full time, and wanting him to be safe. And same thing with my parents. So my parents are in Prince George's County, and just wanting them to be safe throughout this as well.
All right, well, let's get started with the big questions. Who is eligible to get COVID vaccine in Baltimore City?
That's a great question. Right now, all individuals 12 and up are eligible to get the vaccine. If you're over the age of 12, you can get the Pfizer vaccine. If you're 18, you can get Pfizer, Moderna, or Johnson and Johnson vaccine. So it is everyone above the age of 12 is now eligible for the vaccine.
And how much will it cost?
It is completely free. That's the great thing about it.
Oh, okay.
This is a life-saving tool that is completely free.
Completely.
Completely free.
All right, so listen, everybody's watching. You don't have to dig in your pocket. You ain't got to wait for no STEMI check to come. Just go ahead and get the vaccine. Now, what are the side effects from it? Because I got Pfizer.
Okay.
And
what were your side effects if you had any?
The first shot, I think I was just tired. Mm-hmm. And my arm hurt for maybe a day after. The second shot, I got a little bit sick, but not too sick. I just felt like wheezy or queasy, whatever word you want to use. And then a day after that, I was fine. And then I went back to normal.
Yeah. So for me, I also had arm soreness, and I've had arm soreness sometimes with the flu shot. So my side effects were arm soreness. I had a mild headache with the first shot, but I took Motrin and I was fine. For the second shot, I was a little bit tired, but I work a lot, so I'm often tired. So I didn't know that was necessarily different from my norm. But these are common side effects. Most people might experience pain or soreness at the injection site, headache, fatigue, muscle aches, nausea. Some people experience chills. They're usually mild, and they last anywhere from 24 to 48 hours. Side effects are a good thing because they let us know that the vaccine is working. Let me be clear. Even if you don't have side effects, the vaccine is still working. But again, these are mild side effects that can usually be treated with Motrin or Tylenol if your doctor says you're allowed to take those medications.
That's good right there. We're talking to Dr. D, which is the head. I always mess it up. You are the head of the health department.
The health commissioner. Yep. Same
health
thing.
Commissioner. All right. Same thing. And you can check out weekly pop-up vaccination schedules at baltimorecity.gov/BeMoreVax, or you can call 443-984-8650. And that number and website will be scrolling at the bottom of the whole interview right now. Now, do you got to sign up for this, make an appointment for a vaccination?
So you don't. We're at a point where there is much more demand or much more supply rather than demand. So we have a lot of walk-up clinics. And so check out that website. it will indicate the time and location of the clinic, and they are throughout the city as opposed to having just one fixed site. And it'll also indicate the ages that are available to get the vaccine. Is Pfizer being given there so that you can bring, your adolescent, or is it just for 18 and over? So all of that information, as you mentioned, can be found at our website, or you can give our phone number a call.
So if somebody watching again, you don't need an appointment, you can just walk up. Real simple. What if you don't have access to an internet?
You can call us. So our call center, 443-984-8650, and it's available to help you schedule an appointment. They're open Monday through Friday from 8:30 a.m. to 6:30 p.m. and then Saturday from 9 a.m. to 1 p.m. So give them a call and they can help you schedule or find a location if you, for whatever reason, can't get on the internet.
All right. Tanisha checked in just now and asked, are there side effects different with each type of vaccine?
They're pretty similar across the different vaccine types. I have heard kind of the nausea and chills being a bit more reported with the Johnson & Johnson vaccine, but it's a pretty similar side effect profile for all three of them.
And now Johnson & Johnson is good, because I remember being on the radio and talking, and some things was happening with Johnson & Johnson, but they now are great.
Yeah, so the CDC did pause use of Johnson & Johnson while they were investigating some side effects that were reported. And specifically, they were side effects noted in women. So women between the ages of 18 to 50, they noticed they discovered very rare blood clots in women. But again, after doing the appropriate research, after looking at all the data, these side effects are extremely rare for this group. And the risk of getting COVID is much higher than the risk of experiencing these side effects. So again, these vaccines are all safe, and they're all very effective, even against the new variant, the Delta variant.
Now, I know, we living in Baltimore City. There's definitely a transportation need to get around town. What about if someone don't have a car? How can you pick them up? Are they getting rides?
Yes, absolutely. So three options if you don't have a car. The first, if you're mobile, even if you're in a wheelchair or need additional support, you can call 410-372-3444 for transportation. So we can arrange transportation to any vaccination site. It doesn't have to be the health department vaccination site. Or you can email covidtransport@mjminnovations.com. Again, phone number to call and schedule a ride, 410-372-3444. Call in advance, and they can take you to get that shot. Uber and Lyft are also offering rides. So if you have that app on your phone, you can indicate that you're going to get a vaccine, and they'll offer free rides. For those individuals who really can't leave the house, perhaps you have health issues that have limited you to the house, you're considered to be homebound. We're also vaccinating people who are homebound and have no options for transportation at all, or have an inability to leave their home for whatever reason. If you are homebound, you or your caregiver can also call our hotline, 443-984-8650 to schedule that vaccine.
Well, our boss, Kelson, the Urban Informer, just had a question. If we getting vaccinated, is there any word that we will have to do it again yearly, seasonally? How that's going to look?
So there has been some school of thought that it might need to be annual, similar to the flu vaccine, but a lot of studies are showing prolonged what we call immune protection. So a lot of people, they'll have antibodies that help us fight off the vaccine for 6, 8, plus months after receiving that initial dose. So I think we're still narrowing down if and when we'll need a second dose, but it is likely that there will be booster shots at some point.
Yeah, because I'm not going to lie, I don't get flu shots. Because the last time, I think in my 20s, when I was got a flu shot, I got real sick. And I was like, well, I really don't need it. So what about those people that's on the fence that's like, do you need it or don't you need it? What message you got for those?
You need both. So I'm a pediatrician, so I know, a lot of individuals are concerned, talking quickly about the flu shot. I do hear people have concerns about the flu shot. But we just talked about some of the side effects of the mRNA vaccines, right? The flu shot is similar. some people do experience mild side effects. When I used to get the flu shot, I've experienced soreness in my arm. I take Tylenol or Motrin. I've experienced a headache, and I get the flu shot every year. I have for years. I've experienced a headache before as well. And so similarly, some people experience side effects with the flu shot. It still means you should get it. Those side effects are generally much milder in comparison to actually getting the disease. And they're short-lived, right? It's 24 to 48 hours of discomfort. And I'd much rather people, have that 24 to 48 hours of discomfort if they can take the time off work, than come down with actual COVID or actual flu where you're in the hospital for days, weeks, or months.
I'm not going to lie to you, Dr. D. I really didn't want to take the vaccine at first.
Yeah.
Because it's so much gray areas and how it happened so quick, and we got a vaccine and we got to, like, can you give me any encouraging words for those out there that, just like me, skeptics, people that be like, I don't want to take no vaccine. I ain't need it before. I don't need it now.
Yeah. So, first I want to say that I understand. I get it, right? Like there has been a history of experimentation in our community. There's been a history of medical exploitation in our community. And so I understand, people who are concerned about what does this really mean? At the same time, I made it a point to look at the data. I reviewed the clinical trials, and I get that I'm a physician, and so I'm looking at it through a different lens. But I reviewed the clinical trials to make sure I understood, because I'm making an informed decision for myself and for my family. So I wanted to make sure they were safe as well. So I completely get it. I want to say that the technology that's been used to develop the vaccines is not new. So though the vaccines are new to the market, there have been many clinical trials that have shown that they are safe and effective. And they were approved by the CDC, by the FDA, because they are safe and they are very effective. If you follow any of our data on what's happening in the state and in Baltimore City in terms of our cases, you've probably seen how case numbers have plummeted. That's because people are getting vaccinated. It is protective. And again, it's safe and effective. More than 280,000 city residents and more than 157 million U.S. residents have received the vaccine to date. And if we include how long the vaccine's been given for the past, it's really been given for the past year, if you go back to the clinical trials, and we haven't seen, significant long-term side effects to date. So it's safe, it's effective, and we're seeing the results of that with things being able to open up and case numbers going down and hospitalizations going down.
I saw that one of my best friends, I've known this guy for more than 50 years, even though I'm not 50, but I've known him that long. Dave Wilner said, how should we feel that is not FDA approved? But can I help answer this one? I've noticed after COVID started, I started looking at a lot of medicines and things that's not FDA approved, and we still take those as well.
Yeah, so that's a good question. So it is partially approved. So it's approved under what's called an emergency use authorization. And that happens when we've had the clinical trials that have been done, but we're still, again, collecting additional data. So we do anticipate full authorization likely in the next few weeks for the vaccines. So they are approved under emergency use authorization. They have been reviewed by the FDA. They've been reviewed by the CDC's Advisory Council on Immunization Practices. Again, which these are physicians, these are clinicians that are experts in the field of vaccination. And so I would say, again, if you have questions, I always encourage you. It's great to tune into these things, but talk to your clinical provider. Talk to where you get your healthcare if you're even more curious and we don't answer all your questions.
And you said earlier, hold up, here's another question real quick. About that, another one. Are these symptoms the same for the Delta variant of the coronavirus? Will booster shots be needed for those that are currently vaccinated? I think you said a little bit of that.
Yeah, so likely there will be booster shots even for those that have currently been vaccinated. The Delta variant symptoms, there are similarities. I think what's really important to note though with the Delta variant is that it's much more what we call transmissible, right? So,
Okay.
when we think about the regular coronavirus or even some of the other variants, we know that it's airborne. We know that it can spread in close contact. That's why we recommended the social distancing and the masking. What we're seeing with the Delta variant is that it spreads even quicker, right? And so
Wow.
that's kind of scary when you think about it, right? Knowing how
Mhm.
quickly, COVID spread in the first place. And I'm especially concerned about unvaccinated individuals. We're now seeing, when you look at the data of who's being hospitalized in the state, more than 90% of those hospitalized are unvaccinated.
Wow.
And again, we know that the vaccine reduces hospitalizations, reduces your chances of getting COVID, and reduces your chances of spreading it. We've seen it. We see it with our case numbers. So I
Mhm.
really hope that those that are on the fence, that are still thinking about it, would get more information so that they can make that informed decision.
A lot of people must have got all the questions I was about to ask you. The
Okay.
last three questions, I'm looking at the list like, wow, they know what I know. So you said the youngest age person that should be vaccinated is how old?
12 and up currently. Yep.
All right. So my daughter is 14 going on 15. She should get vaccinated.
She should get vaccinated. Yep.
A big question. You said you have a 4-year-old. I have a 6-year-old as well. Why they're not vaccinating the younger kids?
That's a great question. So the way that clinical trials are done in the U.S., we typically start, and this is all vaccines. This is not just specific to COVID vaccines. We
Right.
start with like a healthy adult population, right?
Mhm.
So the initial clinical trials started with adults 18 and up, right? And typically, we also don't include pregnant women. And so there was a lot of question early on about whether or not pregnant women could receive the COVID-19 vaccine. Subsequently, many women in the trials got pregnant or found out they were pregnant after the fact. And so it is recommended that pregnant women get it. But this, just thinking generally about how clinical trials work, usually it starts with 18 and over. And then over time, it begins to be expanded to younger populations. And so right now, they're doing the clinical trials in
Yeah.
children under 12 for the purposes of having a vaccine, of understanding what's the appropriate dose for smaller children. Oftentimes in pediatrics, we dose based on weight as opposed to age even. So doing those appropriate clinical trials now to understand, when they'll apply for approval for younger populations. We anticipate, right now Pfizer's the only one approved for 12 and up. Moderna is likely seeking approval for 12 and up in the next few weeks, likely
Okay.
this month. And then we'll also see probably some of the companies seek approval for Pfizer and Moderna for, again, school-age children sometime in the fall.
And now let's get into the mask. Oh, nope. Gary's right there. Wait a minute. Forget the mask. Gary want to know, how would community or social orgs get involved with helping agencies to get the information and vaccines to the populations who have not been vaccinated?
That's a great question. I think the first place really to start is our website. So coronavirus.baltimorecity.gov. And we've got a lot of useful information. We mentioned that we post our vaccination schedule each week on that website.
Mhm.
We also have many flyers and materials that discuss whatever, the latest mask orders are. We have a frequently asked questions section around whatever the latest orders are. And
Right.
we have a dashboard that shows case counts, and we have a separate dashboard that shows vaccination status across the city. So what I love about our vaccination status dashboard, it shows where we are as a city, what percentage of us have been vaccinated, and also shows portions of the map where vaccination coverage is lowest. So you can look at your zip code and figure out what's the vaccination coverage in my area, so
Okay.
that you know kind of where to focus your efforts. And that's
Mhm.
how we make decisions around where we place our vaccination clinics. We're really trying to focus on that area with the lowest vaccination coverage.
As of July 1st, Governor Hogan said you can take that mask and get it out of here. How do you feel about wearing the mask still in Baltimore City? And where do you think we should still wear our mask?
That's a great question. So we actually aligned with the state, and the order to wear masks was also lifted in the city on July 1.
Mhm.
We're excited because just this week we hit 60% of all adults, those over 18, with either a first or a single dose of vaccine. We're not where we want to be yet, but
Right.
we're moving in the right direction. So when I think about kind of mask wearing and how to approach it, I think there's two ways to think about it, right? If you're vaccinated, you can actually go, you can be without a mask. You can be outside without a mask. You can be indoors without a mask. And you're relatively protected because of your vaccination status.
Okay.
If you are unvaccinated, when you're indoors, I still strongly encourage you to wear a mask, right? Again, knowing that indoors, the vaccine is much more likely to spread, and you're susceptible because you've not yet received that vaccine. So again, vaccinated, outdoors, indoors, take your mask off. If you're not comfortable, many people who are vaccinated still wear their masks. Occasionally, you'll see me still wearing my mask because my 4-year-old has to wear his mask. And so I want to normalize it for him. But again, if you're vaccinated, you can go maskless. If you are unvaccinated, no matter your age, you should be wearing that mask in an indoor setting. And again, not required, but you should.
Right. That's where I can feel like a little piece of problem is going to lie. Yeah. Because if you're not vaccinated, but the state says, hey, you don't have to wear your mask, I'm not going to lie. I would have been one of the guys, like, all right, I don't need to wear my mask. But thank God I'm vaccinated. And it is very weird now to go in the store and see people still with their mask on, some without their mask. And you really ain't going to know who lying or not.
Yeah. And it's a personal choice. Again, like I said, I'm fully vaccinated, have been for months. But again, especially if I'm out with my son who's 4, he's not vaccinated. He's not eligible to get vaccinated. I want him to keep on his mask. And he's very good about it. He always has been. And so, we wear a mask together so that he, doesn't feel like, well, why is mommy not wearing her mask, but I'm wearing a mask.
Right. Well, Ms. Clonetta has tuned in again and said, how soon will the vaccines be available for the children under 12?
So likely the manufacturers who make the vaccines are doing clinical trials now and will probably apply for approval this fall or winter. So hopefully around the time when school starts, but certainly could be a little bit later.
And if not later, you can get a vaccine for Christmas for the kids. Unwrap a box and be like, hey, I got a vaccine.
You know what? Well, so you raise a good point. I do want to take the time to very quickly plug. There are other vaccines that our children need. So if, in the midst of a pandemic, you got behind on getting your children their school vaccinations, maybe because they weren't physically in school, use this summer to get caught up on those other vaccinations.
Yes. About the Delta variant. Can you tell us about it first? Because to me, it's brand new. It seemed like something else I got to be scared of. What is it?
Yeah. So I'll first start by saying that variants to a virus are common, right? So we commonly see that as viruses replicate, meaning when they're transmitted, they're replicating, right? When they're transmitted between people, they're replicating. And so mutations are common. And so, this variation is common. And so the way that the Delta variant came about, originally it was thought to be just a variant of concern, meaning they were observing to see the transmissibility I mentioned, like how quickly is this spreading? And then they saw that it was becoming more dominant in certain areas of the world. And we're even seeing in the United States where it's becoming a more dominant variant, meaning when we sequence when we look at it in the lab, that the Delta variant is just becoming more common. So I'll first say that. I think one of the things that it does for me is that under lies the importance of getting vaccinated. We want to stop that vaccine from replicating. And part of that is stopping the spread, right? So getting vaccinated really helps us to do that. The biggest thing, as I mentioned, is that it is more transmissible. But the good news is that the vaccines that we have on the market now are highly effective against the Delta variant if you are fully vaccinated. And I want to stress if you're fully vaccinated, because we know that for the Moderna and the Pfizer, it takes 2 vaccines. And so what we saw with Pfizer, for instance, is one vaccine is about 33% effective. But if you get both, it's 88% effective against the Delta variant. So I want to plug for those that have gotten their first dose but haven't gotten their second, please get your second dose. It really is effective.
Man, should we be concerned about the Delta variant?
So I think the concern really lies for unvaccinated people. The concern that I have as I think about us transitioning to the fall, and I'm thinking this is like my health commissioner hat on, is that as we move indoors and where masks are off and things are fully open, we will likely see some spread. We may see cases go up. It will be particularly severe in people who are not vaccinated. we will see that spread in individuals who are not vaccinated. And so I think the concern should be, if you're unvaccinated, this is a risk. It really is a risk.
Listen, let's shout out the website again for the weekly pop-up vaccinations. All you got to do is go to www.baltimorecity.gov/BeMoreVax, and that's with an X, or you could call 443-984-8650. Talking to Dr. D, the head blank in charge of all vaccinations in Baltimore City. Let me ask you, in parting, what could you tell anyone that's not vaccinated? We said it a bunch, but if someone is watching right now and they're like, I don't know if I should be vaccinated, what can you tell them?
So I think a couple of things. Again, I'll say that I understand and I get it. I understand the hesitation, but I would encourage you to get the information. Get it from the CDC, get it from the Maryland Department of Health, get it from our website, so that you're making an informed decision. Additionally, we talked a little bit about the side effects here. If you know people who've received the vaccine, and you're wondering what are the side effects, consider reaching out to a friend or a family member who's gotten the vaccine, that you trust, is going to give you, valuable and helpful information. And in my head, one of the great things about being vaccinated, is that it does allow me to drop some of the fear, right? Like, I still have a 4-year-old at home that I want to keep safe. But I have, less fear if I'm going out or I'm out and about of potentially bringing it home to him. And so, think about maybe others in your life that could be susceptible to getting COVID-19 and getting serious illness from COVID-19. Even if you don't think you're the person who can be, if you get sick and you spread it to someone in your household, could they get seriously ill? So I would be mindful of that as you're thinking about it and as you're making a decision. And as always, I'm a pediatrician. Talk to your provider, talk to your primary care provider, talk to who cares for yourself, for your children. Ask them the questions that you have to.
Dr. D, thank you so much. Is there any way can someone follow you right now if they have any questions?
Yeah, so I am at the official Doc D. So I'm on Twitter and I'm on Instagram as the official Doc D.
I'm gonna go on Instagram right now and follow you. As soon as you say something, anything, I'm gonna be like, Dr. D said. Put it down there, man. Thank you so much for your time, and let's get vaccinated.
Please get vaccinated.
Since you are the head, I did want to leave with one question. Who I gotta see to get my $40,000 from the state?
That's from the state. That's from the state. That's not a city promotion.
You, Mayor Scott or Hogan, I'm waiting to see my $40,000 coming.
Yeah.
Thank you so much.
Yeah, thank you.
Be safe.
You too.